Today we're going to do a D-stat radial band removal. Before you remove the radial band, we need the gathering supplies, sterile glove, 4x4, cold dressing. That's how it looks in the package. We need a pen or marker and a scissors to cut the cold dressing. Before the removal, we're going to assess the patient for the radial pulse, proximal to the band and the distal to the band. Just noted where the proximal is very important. If the patient is bleeding, you need to hold the pressure tight and tighten the band back up. First thing you need to do is notice where it is, gently release the band, just a little bit, but too much, and observe for the site. Make sure there's no active bleed. If the patient has active bleed, click back where it is you're released from. Come back in 5 minutes and then retry it. So now we're going to actively remove it. You have your radial pulse. We're going to release. Everything looks good. No bleedings noted. Everything looks great. Everything is soft. We're going to release a little more. We're still looking good, no bleeding. Now we're going to loosen up the tag. Gently rock the latch back and forth. Release it from the plastic. Remove it again. Loosen up more. Make sure there's no bleeding. Completely remove the band and put a pressure proximal to the band. Okay, band is removed. Hold the pressure for at least 2 minutes. If there's no bleeding, we'll check the site. Gently release your hands. Make sure everything is looking good. No hematoma, everything's soft, no active bleed. Now we're going to put on the dressing. Take your 4x4, roll it very tight. Place it right on the D-stat patch. Try not to remove the D-stat patch if you don't have to, because this is actually going to keep the hemostasis. But if the patch becomes saturated with blood and it's already loosened up, then you can take it out. Otherwise, leave it on. Put the gauze right on top. Take your cold dressing, wrap it, stretch a little bit, so make sure it's a little tight, and now we can cut it out. About a roll and a half. Don't do too many times, then you become occlusive. You're going to cut off the circulation. Okay, dressing is on. Feel the pauses. Turn the hands around. Check the capillary refill. Everything looks good. You can put your dressing. So let's say it's 5 o'clock now. So the dressing needs to be removed in 24 hours. It's clear. It says remove the dressing at 5 p.m. the day after, which is February 22nd. Okay, the dressing is on. You're going to instruct the patient, keep an eye on the bulging part. That's the gauze. If the area becomes saturated, bloody, that means it's bleeding. What you need to do is, patient, take his other hand, take the thumb, push right on the gauze, and hold on tight, and call for help if the patient is in-house. Call the nurse. If patient is home already, hold the pressure for 5 minutes, very tight. The bleeding should be stopping. If it's not stopping, call 911 and go to the emergency room. Okay. The soreness at the incision site and bruising is expected. It should resolve within 1 to 2 weeks. That's expected. If you have excessive pain, bleeding, changing of sensation, you have numbness and tingling down your fingers, that needs to be reported to the physician. To instruct the patient in 24 hours to remove the dressing, we'll have them taking off the label and the cold band dressing. Remove the 4x4. If the patch is still on the skin, do not peel it off from the patient, because if the patch has blood on it, you will peel patient's skin. So instruct them to run under the faucet for like 30 seconds so the patch will be fully saturated and wet. Gently loosen up and peel it away from the patient. Pat it dry completely, and then you can have them put a Band-Aid on, cover the incision.